And welcome to the Prescribing Prosperity Podcast with your hosts, John and Alex Soutsos. Gentlemen, good to see you.
Good to see you too, Bill.
Nice to be back, Bill. How you doing?
Despite the results of recent athletic contests, it's good to be with you.
Now, what contest would those be, Bill?
I don't know. I can't. There's some minor sport that people apparently don't really care that much about.
Oh, you mean the hockey game?
Congratulations to my friends up north. It was fun. It was great, and it was so worth staying up to midnight to watch.
Absolutely.
We don't get a lot of victories in this country, but we got one last week.
No, and it was great. It was hard fought. It was well won, and I enjoyed it all the way through. Disappointed for me at the end, but wow, it was great. I don't think,
too bad we had to wait 9 years for it.
We all get together next year. So, we
Exactly.
all get together again next year.
I have a feeling this is going to turn into the same thing as the women's hockey, where they alternate between the two countries who wins.
I know. All that matters is that one of the two of us are always the best. That's all that really matters, right?
Keep it on this side of the Atlantic.
Exactly. Well, speaking of things that are exciting and interesting, I am intrigued by your guest today. For our listeners, Dr. Lynda Thompson has a really impressive set of credentials that include a PhD in clinical psychology. She's a practice school psychologist and owned learning centers prior to making a shift to more traditional psychology. She became the executive director of the ADD Center in Toronto and Mississauga in 1993. And for over 30 years, she has specialized in applying training that utilizes neurofeedback, biofeedback, along with metacognitive strategies to improve client self-recognition skills and self-regulation of attention. And that, folks, is just a taste of her accomplishments. For her full biography, please check her out in the show notes. Alex, with that introduction, I turn it over to you.
Sounds good. Thank you, Bill. Thank you for joining us today, Lynda.
I'm delighted to be here. Thank you for asking me.
Absolutely, our pleasure. We're looking forward to this conversation. It's a subject that I think is very important, and I think a lot of people don't really appreciate the degree to which that cognitive aging is imperative to their overall long-term health. People think of they think of their working lives, and they think of retirement, and they expect that it's just going to be a relaxed version of their adult years when they're working. And what matters though is that your brain is in a position such that you're able to actually appreciate and enjoy your retirement, because far too many people unfortunately get to the end of their life and the last 10 to 15 years, and they suffer cognitive decline, and that can impede and erode their standard of living at that point in their life. So why don't you give us a little bit of an overview? I know Bill gave us a bit of your background, but give us a bit of an overview of your career and working in cognitive therapy and working overall and helping people with their mind.
Right. So really what I'm interested in is applied neuroscience. So you take the latest research in neuroscience and you apply it in the clinic. So you do brain training and you do biofeedback. But what I really want to talk about today is all the things we recommend that our clients do outside of their training with us, because it's all about health span, not just lifespan. Mm-hmm. And if they're going to get the most out of the relatively expensive one-on-one training that my clinic provides, I want them to do things at home that are going to enhance their cognitive and their physical well-being.
Absolutely. And that makes a lot of sense. Dr. Peter T has talked about it at length. It's not enough just to have, lifespan. You need health span, like you said, because mm-hmm. you want to live a long time, but you want to live a long time and still be in a functional capacity. So why don't you give us a little bit of overview? One of the things that you've talked about is the acronym BODES. What does BODES mean, and how does it apply to brain aging and cognitive health?
Right. So we actually give our clients a handout that's what bodes well for aging well and for living well. So BODES stands for B for breathing, O for online exercises. So although I'm not a fan of computer games in general, there are some with science behind them that are helpful. And then D is for diet, E is for exercise, S is actually two S's. One is for sleep, which is hugely important for your health span, and also socializing, because we are social beings and having a social support network is extremely important for healthy aging.
Absolutely. So what happens to our brain? Let's give the listeners a little bit of an overview. What happens to our brain as we age?
Well, if you're fortunate, it continues to stay sharp. But in general, there is a bit of a slowing down in your brain. So, for example, we can measure brain speed, and the actual speed of your brain slows down a little bit with aging. So, there's something called a peak alpha frequency, which is kind of like the rate at which you sample the world. And for the average adults, it's at 10. And then starting at age 50, you lose about half a hertz, half a cycle per second with every decade. But, research shows that these days they're studying centenarians, so people who've lived to be 100, and they find that 25% of them are still cognitively sharp. So if you, if you have a health span, you can stay sharp into your, in past 100.
So can you maintain that level of 10 if you do all the right things in order to try and support and keep your mind exercised and sharp to the point where it's at the same level, or is it always going to decline a little bit and you're just trying to slow the rate of decline?
Well, you want to slow the rate of decline, and also some people start a little higher than 10.
Okay.
Right? So there is some correlation with brighter people having a slightly faster brain speed, but it's like many things. There's a Goldilocks spot. Like too fast is associated with things like post-traumatic stress disorder, where the person is like so anxious, they're hyper vigilant, and
Right.
their frequency can be too high, right?
Right.
Like you don't want to be at 12.
Yes.
And
Fair.
is there a solution for that?
Well, you can do brain training.
Right.
Yeah, and there's some other things these days that are coming online, which we also offer, like photobiomodulation, which is light therapy, where you could just apply light and certain frequencies that will increase blood flow and also increase the action of the mitochondria, the energy in cells. So it's used for healing, but it can also be used for brain brightening. So like brain brightening in the elderly is one of my pet topics these days.
Nice. So when you have a level, so 10 you said is kind of the Goldilocks zone, I assume, like if you were at an 11 per se.
Normal range is 8 to 11, right?
Okay.
8.5 to 11 or so. So like a person in a coma could have their peak frequency down at 2 or 3. Like they can
Really? Get
Yeah.
that low.
yeah.
Okay.
It's like their dominant frequency. It's also called dominant frequency.
Okay.
Yeah.
So
Yeah, but
let's
that's
talk a
more
little
about
bit.
brain stuff. Let's get back to things people can do at home, like B for breathing, right? So, for
Absolutely.
example, as I was waiting to come on here, because actually, this is my first podcast. I've done lots of presentations worldwide, but I've never done a podcast before. So, what do I do to make sure I'm relaxed? I do effortless diaphragmatic breathing. And that's something like anybody can practice. It's the rhythm that I recommend is 4 in and 6 out. So if you think of a 10-second breath and you just let the air in, 2, 3, 4, out, 5, 6, 7, 8, 9, 10. And that longer exhale recruits your parasympathetic nervous system, so the calming part of your nervous system. As you inhale, it's activation. As you exhale, it's calming. So if you have a longer exhale, you're going to be calming your nervous system.
Okay. And is that what slows down the heart rate? Is the fact that it's the parasympathetic nervous system that's kicking in?
Well, it's not actually heart rate itself. It's your interbeat interval. It's getting a little
Okay.
technical. But your heart is not a metronome. It doesn't
Okay.
beat with exactly the same speed all the time. As you're inhaling, it's getting a little faster. As you exhale, it gets a little slower.
Okay.
And,
The
and
reason why
that's
I ask is
healthy.
okay, because I was watching or I am in the process of watching Limitless on Disney Plus, the the 4-part documentary series on Chris Hemsworth and his journey towards he's trying to focus on longevity and increase his body's health and increase. He's working with actually Dr. Peter Attia in a few of the episodes on healthspan. And one of the things that they do, because he's doing all of these different basically physical challenges, like one of them is he's swimming in the sea in Norway, like he's swimming out in the frozen ocean in Norway. Another one was he was on a 90-story building, and he was walking across a crane on just like a little beam. And anyway, obviously those are very traumatic and stressful situations that you're placing yourself into. And one of the things that they worked on with him was breathing, and something called box breathing. And so it sounds like it's very similar to what you're describing here, where it's an extended, breath where you try and, for the box breathing, I think it's 4, 4, 4, 4. So,
Right.
4 in, hold for 4, out for 4, and then hold for 4 again before you take your next breath.
Yeah, it's a little more natural just to do inhale, exhale,
Yeah.
and you can fit it into everyday stuff. For example, driving here to my office, I hit red lights. So years ago, I'd come to a red light and my shoulders would tense up and I'd feel annoyed because I was usually, running late. So now when I come to a red light, I think, 3 breaths, because most red lights last for 30 seconds.
Right.
So I can just relax my shoulders, let the air in, do that slow exhale, do it 3 times, the light changes, and I'm relaxed. Because the important thing about managing stress, and this is a side topic, I could do a whole hour on stress, is that we all have stress. Usually every day we'll have little stressors and sometimes big stressors. And it's not, as they say, it's not the burden, it's how you carry it. So it's how you react to your stress. And if you can recover from a stress back to your baseline every time, at the end of the day, you're fine. But if you have a stress and you get a little more tense and the next one a little more tense, by the end of the day, your shoulders are up by your ears and you're not in such good shape. So,
Right.
So it's all about managing stress and recovering to your baseline. So if a red light's a stress, it's really great by the end of that red light to be back at baseline or better because you've consciously relaxed.
Okay. What if your baseline is stress? I don't think I know anything beyond stress.
Well, then you've got to look at your lifestyle. And maybe some of the things we discussed today under BODES will help. So breathing, try that effortless diaphragmatic breathing.
Okay.
And yeah, and if you want to have you can get a pacer for this. So there's the Biofeedback Federation of Europe website, BFE, Biofeedback Federation of Europe. Go to their website and you can download their Easy Air. So the letter E, the letter Z with the American pronunciation, Easy Air, and it gives you a pacer for that effortless diaphragmatic breathing. And diaphragm, because you want to use the diaphragm. You don't want to have shallow chicken breathing with your shoulders going up and down.
Right.
You want to let the diaphragm expand, so your tummy goes out as you let the air in. The tummy goes in as you exhale. So sometimes girls who like their tight jeans, they don't like doing this because they don't ever want to have a tummy show, but it's actually very healthy to use the diaphragm. So people who are singers or musicians, especially wind instruments, are going to do this quite naturally.
Right. And one of the things that I noticed that you mentioned in one of your presentations was heart rate variability training. So
Right.
Can you talk a little bit about that?
Yeah, so the variability in the beat-to-beat interval is actually very healthy. As I said, your heart's not a metronome. So the higher the variability, the healthier. The only time you have no variability is if you have a pacemaker or just before a heart attack. So heart rate variability is a measure of cardiac health, and you can increase it by getting your heart rate changes in sync with your with the changes in your beat-to-beat interval. So
Okay.
so these days there are a lot of apps for heart rate variability. So you can look up different apps and practice it. You can so if we're doing it in the clinic, we have a respiration belt around the tummy to measure that diaphragmatic breathing, and we put a plethysmograph on the thumb or finger, so that's measuring your pulse. But some of the apps will use your phone with the flashlight to act as that plethysmograph to get your pulse, say, from your thumb.
Right.
And they can do pretty accurate heart rate variability training. So you can just look up various apps for that. It's really healthy stuff, and there's a whole science behind it. The whole polyvagal theory of how to relax the vagus nerve. So the vagus nerve is this really important nerve that's the longest nerve in the body, and it connects the brain and the heart and the gut. So if you can calm your vagal system, that's a good thing.
And so, how do you? What are you doing when you're doing these exercises? Is it you're just focusing on changing your heart rate? You're trying to change your breathing pace in order to change the heart rate. Like, how does it work?
Yes, typically you can do it with the breathing.
Okay.
And if you have the feedback, you can see if your breathing is getting in sync with the heart rate changes.
I see. And so, would a smartwatch like an Apple Watch or the Samsung equivalent are those accurate measures of things like heart rate and breathing, or are they a bit of an estimate, and we're using our best extrapolation, if you will?
Yeah, I mean, of course there can be prone to artifact, but it's I think it's a really good start. I mean, people are so much more aware now of physiology and of measuring physiology because of all these things like smartwatches.
Right.
And those smartwatches do have an HRV, a heart rate variability measure. Yeah.
Okay.
Yeah.
And
I was
so
actually at an event and ran into a cardiologist. And this cardiologist, a fairly newly minted cardiologist, really didn't know about heart rate variability training. And he said, it's on my watch. He said, but I don't really know what it means. So I had to explain to him what the standard deviation of the beat-to-beat interval was and what it all meant. So he's going to look into it more.
Okay. Maybe we should all be doing that. Or I guess not maybe. We should all be doing that, I should say.
Or just do that effortless diaphragmatic breathing. It's
Right.
Yeah, doesn't cost anything.
No, absolutely not. Like you said, just finding some time during your day is a great way to do it. That's a great suggestion. Just sitting at a red light and got nothing else going on, you may as well, instead of thinking about where you should be and why you're late, just try and focus on your breathing and try and bring your heart rate back into an optimal level.
Right.
Lynda,
I know it's like, yeah. Go ahead, John.
Is this where meditation helps? I know there are people who it's recommended that you take some time every day and meditate, whether it's 10 minutes or whatever length of time. Does the act of meditation assist, or is this part of the process of meditation?
Well, meditation is very good in terms of emptying your mind, right? So the whole idea is that ideas come and you let them go. Ideas come and you let them go. You expect to have distractions come, you expect to have thoughts, but you just let them go. And typically when a person's meditating, they're sitting quietly, and they usually will slow their breathing. So
I find that certain music helps calm you down. Can you elaborate a little bit more on that?
yes, sound is very important, and you can pace your breathing with sounds as well, and there's research that shows that songs that you associate with happy times during your life are great mood boosters. So, so depending on what era you grew up in, you might want to listen to, 50s rock and roll or ABBA. It seems ABBA is the one kind of music that's still popular today that was popular years ago. Yeah.
Unbelievable. And they didn't even speak English. They just sang in English.
Right. But they had good rhythm and upbeat. So there's this polyvagal theory by a very famous psychologist by the name of Stephen Porges, and he has an intervention using listening where he takes out all the low tones that he calls the predator tones and just has the higher pitch things. So if you think of zippity doo dah, zippity yay, those Disney tunes, they're happy and they're higher pitched, as opposed to da 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 da, which would be
Right.
a predator tone. So
Okay.
yeah, so music, good question there. So yeah, listen to music that you like and that lifts you up.
So it can be any music you like. It doesn't necessarily have to be a particular classical piece from
Right,
one of.
right. Now, I mean, that being said, all my grandchildren got baby Mozart as one of their first baby presents. There
Very nice.
is research that shows that Mozart, with the particular fades and increases and repeats, is the healthiest music for the brain. It most closely imitates natural brain rhythms. There's an epileptologist and a neurologist who specializes in epilepsy called John Hughes, and Dr. John Hughes will play Mozart's music as well as administering medications, anti-seizure medication, if he has someone in status epilepticus. And he says they come out of it faster. They'll come out of the epileptic seizure faster with the music plus medication than medication alone.
That's fascinating that the music would have such a big impact on returning them back to equilibrium.
Right.
And so, you want to, in your presentation, and perhaps when we release the video for this, we can get them to include the image for this. But there's a page where you have all these different statistics showing EMG data. Can you discuss a little bit about that data, and perhaps what is the optimal range for heart rate variability?
Yeah, so EMG is something. EMG is electromyogram. That's your muscle tension. But there is a graph that shows this, like mountains. Red mountains are showing your heart rate increase and decreasing. The blue mountains are your breath, inhale, exhale, and if you get them in sync, that's very healthy. And there's even a little tip we give people: follow your heart. So if as your heart rate starts to increase, that's when you let the breath in. That's when you inhale. That's the healthiest pattern.
Okay. Interesting. And then last thing that I want to touch on within the segment of breathing is, you mentioned something about resonant frequency. Can you elaborate a little bit on that?
Right. So that's the breathing rate at which you have the highest amplitude of the heart rate changes. So so 6 breaths per minute works well for most people, and that's that 4 in and 6 out, because that'll give you 6 breaths per minute. And there are some fine points here. So your heart rate variability, the resonant frequency, the healthiest frequency for you as an individual, is partly based on your total blood volume. So a taller man is going to have a slightly slower optimal rate for breathing, and children will breathe faster because they're smaller, and
Right.
or a petite woman will be lower, right? So with children, it could be up to 7.5 breaths per minute or 8, and with a large tall man, it could be as low as 4.5 or 5.
So why is it that it changes? Why is it that a smaller person breathes faster and a larger person breathes slower for an optimal range?
They have a smaller blood volume,
Okay.
right? The circuit for your blood to circulate is shorter.
Gotcha. Okay. That makes sense.
And lung capacity would play a role, wouldn't it?
Not so much, actually. I mean, you can have
Okay.
reduced lung capacity, but still, fill up the lungs that you've got left.
Okay. Fair enough. All right. So let's transition over to the O, which is online brain exercises. So tell us a little bit
Right.
about what people can be doing to try and improve their cognitive abilities.
Right. So first of all, don't go down the rabbit hole of playing games on the computer, because most of those games are, especially in young people, are very addictive. Like Fortnite, I think, should be banned. But there are some online exercises that are actually healthy, and the ones that I would recommend are ones that actually have research behind them. So there's a company called Posit Science that created Brain HQ. So think headquarters, Brain HQ, and they have over 100 studies, research studies. There's another one that I won't mention, but it was advertised a lot on the internet. But they actually had got fined for making false claims because they hadn't done the research.
I remember there was a big surge of of a company advertising their online brain games.
Right, right.
That's
Yeah.
the one you're referring to.
Right, right.
Yeah,
So,
because I haven't seen them lately.
right. So don't try to go luminous. Go for Brain HQ.
Right. Okay.
So, and it's you do have to pay for it, but it's pretty reasonable. It's like about $8 a month. So I'm sorry, it's U.S. dollars, but anyway, it's a U.S. company, and they have games in 6 different domains. So you can choose which ones you want to do. There's memory, there's brain speed, there's people skills, there's spatial navigation, there's something they call intelligence, and there are 4 to 7 games in every category, and you can just pay your annual subscription and do it as often as you like. And the spatial navigation games, they've been particularly researched in the elderly, and they actually showed that it increased the volume of the right hippocampus when people were doing those spatial reasoning games. Yeah, so in the brain, the left and right hemisphere is a little more language oriented, right hemisphere is a little more spatial and emotional functioning. So right hippocampus, and this was a spatial reasoning task where you have to navigate things through a maze, or trains changing tracks, or they're actually kind of fun, and they get pretty challenging because as you get things right, then it gives you a higher level of challenge.
Interesting. And so, just a traditional, brain game, if you will, or a cognitive game where you're doing like word problems or math problems, those on their own are not sufficient. Like, you need something that is scientifically curated in order to try and promote brain development, correct?
Well, no, you don't have to. I mean, lots of people stayed sharp before we had computers and these games available. So
Right.
I'm a fan of crossword puzzles, and I'm a fan
Okay.
of, I'm a bit addicted to Sudoku. I limit myself to one a day.
See, I like Sudoku personally. The Sudoku I find very calming. Like, if I'm ever stressed, I usually, it takes me about 4 minutes to play a game on hard, and so I do it, and afterwards, like, it takes my focus away from whatever's stressing me out and helps me regroup.
Right,
I like
because a
that. And
Sudoku, you have to, you're giving it your total focus while you're
Right.
doing it, right? And
Right.
I mean, I think it's preferable to do it paper and pencil as opposed to anything that's screen time. And we all spend too much time screen time. But
So
yeah, it's the same thing with art. So I have a daughter who's an artist, and we talk about the therapeutic value when people take lessons from her, because they're totally focused on, like, getting the color match or getting the shape for that particular thing, and it's very calming.
so algebra and calculus don't count as brain games?
Well, they're sure doing mathematics, I think, is great for the brain. Yeah.
Okay.
Lynda, I've got a question that's it's sort of tangential to this, but some people, myself included, sometimes when you're doing something, I like to have like background noise on. Like, I like to, if I'm like cooking or something, for example, I'll have an old TV show playing in the background, and I find that comforting. Is that bad though for brain development to have too many different forms of stimulus going on at the same time?
Well, what you have to understand is your brain can only focus on one thing at a time.
Right.
It can shift very rapidly from one thing to another. So if you've got something playing in the background, then that's fine. But to the extent that you're listening to that, you won't be as focused on chopping your vegetables, right?
Right.
So, but it's some people, it's very good for them because it'll keep their brain awake,
Mm-hmm.
right? So that they don't kind of get dozy as they're doing something routine,
Right.
or children. So my center is called the AD Center or the ADD Center. You can take it either way, but ADD for attention deficit disorder, I'll find that some kids, they have to fidget a little bit in order to keep their brain awake, or they'll fall asleep in the classroom.
Right.
So then the trick is give them something to fidget with that won't be a distraction, right? You
Right.
don't want them tapping their pen and annoying others. Give them a little squeeze ball or something.
Yeah, I know my wife is a teacher, and I know she says they have like little fidget seats for some kids. Like there's, like you said, kind of tactile things that they can hold on to and kind of just mindlessly kind of play away with, but it's not bothering anybody else, but it keeps them engaged. So
Right. Right.
interesting. Uh,
And maybe, sorry to interrupt, but maybe this is a good transition to diet, because we all know that diet plays a big role in how we how we feel with our mind, and maybe part of the issue with ADD has to do with what people are eating, that it's causing them to have this kind of behavior.
You're right on, John. So that gets us to the D in BODES. So we've done breathing, online games. One other thing I was going to say about online is is a very expensive intervention for online brain exercise for attention, and it's called CogMed, COGMED, and it's Swedish. It's got 20 years of research behind it, but it's expensive. It's expensive because it's administered by a psychologist or a psychiatrist, and you have to do 5 days a week for 5 weeks. So that's what makes it expensive, and I think also because it's expensive, people are more inclined to comply with it because they're paying maybe $1,500 to do it, and it has a lot of research behind it. But it's like attention games that, and I think the trick there is that if you're paying a lot, you'll actually do it 5 days a week for 5 weeks.
you hope so.
Right.
Whereas if you
Yeah.
buy Brain HQ, you may or may not do it regularly. It takes a little self-discipline. But anyway, getting back to the D for diet, diet is hugely important. I mean, there was an article in this morning's Globe and Mail about a Spanish study that showed that people with sleep apnea you could get a 50% reduction in sleep apnea episodes by changing diet, and and the people also on average lost 16 pounds during the 8 weeks that they were changing their diet, and essentially they were switching to what's known as a Mediterranean diet, where there's a focus on vegetables and fruits and nuts and fish. So lean protein, so not so much red meat, but beans and fish and eggs for your protein. Um, and
Well, I can tell you, as someone who emanates from the Mediterranean, the emphasis is on fresh food, whole foods, and I've gone down this path myself for my own health purposes, and I find that you can certainly still continue to have red meat and chicken and all those other forms of protein. The key is, what are you eating with it? Are you eating potatoes? Are you having French fries? Or other simple carbohydrate, starchy things like rice? Whereas if you have those proteins with a salad or other vegetables, as you were describing, it can make a bigger difference in terms of whether or not it's spiking your blood sugar. There's actually a guy on YouTube who does these tests where he eats something and then measures his blood glucose and he shows it on the screen. This is how these two foods interact in your body, and these spike your blood sugar, these don't. So I think the combination of different foods plays a role.
huge, huge. And when you're eating those salads, have the dressing made with olive oil, because
Yes.
olive oil
Yeah.
is a big part of the Mediterranean diet, and and all our processed foods tend to have oils that are not so healthy for us, right?
Seed
So
oils and all
Omega
that.
6s as opposed to the omega 3s.
right, and omega 3s are huge. I mean, that's something I tell every client is to take a fish oil supplement, because the omega 3s, the omega 3 essential fatty acids, are essential for brain structure and brain function. So the structure, so in the brain you've got gray matter and white matter. White matter are all the connections between neurons and long distance connections, like from parietal to frontal, etc. And they're white because of this fatty insulation that wraps around the connections, And that myelin, that white matter, myelin fatty insulation, is made from essential fatty acids, and the body doesn't produce them. You've got to take them in,
Ingest them.
right? So
Now, does it make a difference whether it's fish oil or chia seeds, for example?
no, but the body is more efficient at converting the omega-3s from fish than it is from plant sources. So
Okay.
it'll convert like 70% of the omega-3s from fish and about 30% from plant foods. So yeah, you can get it from plants, and if you're allergic to fish, you have to do that, hemp seeds and things. But it's just more efficient, so it's easier to take. That I take fish oil every morning.
I remember when I was young, the common thing was cod liver oil, and I'm sure that it meets the requirement. And for some reason that fell off. I suppose the taste really turned people off.
Yeah.
But
Yeah, my
these
Scottish
days-
grandmother had me taking. Well, the whole family took cod liver oil all winter.
Yeah,
Right?
exactly.
So yeah.
But now in hindsight that it was important. They knew something, right?
Oh yeah.
Your family.
I mean, my grandmother I was so lucky to have her because she, first of all, she was a good cook and Scottish, so we had oatmeal in the morning, which is actually really healthy. And she also would tell us that a colorful plate is a healthy plate. And if she'd make us eat our orange smiles for our vitamin C, she'd say, remember, vitamins were discovered when I was growing up, right? So
Absolutely.
yeah.
And I want to come back to the oatmeal in a second, but just going back to the fish oil, does it matter if it's in like a capsule versus taking like a spoonful of the fish oil every morning? Like, what's the?
No, it doesn't matter.
Okay.
It's just that some people don't like the texture or the taste of the fish oil. So, I mean, a lot of parents will put it in a smoothie to disguise it. They use the liquid and put it in
Okay.
a smoothie. But if you can swallow a capsule, that's really easy. They tend to be rather large, but there is a Canadian company, Nutra, then SEA, what the fish swim in, that produces small capsules that are
Okay.
that are easier for kids to swallow.
But isn't it more difficult to get your EPA and DHA in the smaller capsules? The quantity?
No, you just take 2 of those instead of 1 of the big ones.
I see. Just increase the
Yeah.
volume. Okay.
Right.
Yeah.
Yeah, and I always tell people to look at the labels and look at EPA and DHA and make sure that the combination adds up to at least 1,000 milligrams.
Right.
Right.
Personally, I take 2,000 a day. And if you're dealing with ADHD, if you're dealing with the kids who have the attention problems, then look for a higher EPA.
Okay.
It helps more with the restlessness.
Why does the EPA impact that aspect of the brain?
Well, there's a bit more EPA in the brain, but so for the elderly, the DHA is quite important. But for anybody with attentional issues, look for a higher EPA. It helps to reduce the restlessness and hyperactivity. Yeah. In fact, one of the newest drugs for prescription drugs is simply a refined fish oil where they've standardized the dose.
Oh, interesting. So right before we're going to take a break here momentarily and continue with diet, because there's a lot we can get into with diet, Lynda, as I'm sure you're well aware. But going back to, you talked about having oatmeal as a breakfast, a healthy breakfast, coming from a Scottish family. I think that's something that you probably would say is, and I'll let you speak before we close out. But the oatmeal that you get in the grocery store, when people buy like the boxed oatmeal, that is not of the same quality as if you just buy your oats on your own and then you do whatever you want, add your own like fruit or maybe add a little bit of like peanut butter or something or protein. Like, how would you recommend people consume oatmeal? Because a lot of it can be very high in sugar.
Right. Yeah. So look for organic oats and actually cook it yourself. Right.
Yeah.
So don't buy the instant oatmeal, and watch out for all the stuff that's that's been modified. Like Quaker Oats actually has come out with a non-GMO, because their regular brand is not the healthiest, just because of because of the fertilizers that are used. But yeah, and on your oatmeal, put some nuts, put some berries. That's what I had for breakfast this morning.
Perfect.
Nuts and berries and pumpkin seeds on my oatmeal.
Yeah, my wife likes to do. We do like a scoop of protein powder in there. Use the milk, and I buy the organic ones from the President's Choice ones from Loblaws, and so and then she'll throw in some fruit or something else to try and add to it. Sometimes chia seeds. So good way to get an additional dosage of omega-3. But
Yeah, and
anyway.
it helps somebody's attention for the morning to get at least 20 grams of protein in your breakfast.
Yes.
Right, so the milk has protein, and if you put on some nuts are high in protein. So
Yeah, exactly. We'll touch upon protein on in part 2 here, but I'll throw it back to Bill, and we'll take a quick break.
Yeah, I was sitting here feeling really good about this oatmeal discussion until I realized I put a lot of butter and sugar in mine. So it's probably
You're okay with the butter. It's the sugar that's going to kill you.
yeah. If you're going
No.
to put sugar on your oatmeal, use a little bit of maple syrup rather
Yep.
than brown sugar. Like
oh, very good.
like a little bit's not gonna kill you, but try to make it, like, if you're gonna have some sugar, try to make it the healthiest sugar you can.
Sure.
Right.
No, that makes a lot of sense. That actually makes a lot of sense. And this is a really good place to break this, because this is a conversation that I think a lot of people are going to want to hear continued, as a matter of fact. So as we go out and we break here, Alex, just really quickly, what is the best way for somebody who's listening to this podcast who thinks they may want to reach out to you, get in touch with you?
Best way to reach out is to send us an email at info@medwealth.ca. That's info@med-wealth.ca.
Excellent. And for those of you who are listening who are not subscribers, subscribe. That's easy. Just hit the follow button. And the reason that's important on this particular episode is that when the next one drops, as a subscriber, you will be notified and you can finish this conversation with us, as a matter of fact. So until next time, I'm Bill Tucker. On behalf of John, Alex, and everybody at MedWealth Financial, thank you for taking the time to listen today. We'll see you in the next episode. Stay with us.
Thank you for listening to Prescribing Prosperity. Visit our website at med-wealth.ca. That's med-wealth.ca for more information or to connect with us for a consultation. Don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the hosts and their guests and does not necessarily represent the views or opinions of IPC Securities Corporation. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investment advice. Always seek the advice of a qualified and licensed financial service provider with any questions you may have regarding your investment or retirement planning. MedWealth Financial Services can provide a private consultation to help you determine the suitability of any guidance discussed on the show.